Hello and welcome to my channel. This is Isaac Simple. Thank you for tuning in to my channel. Kindly, if you have not yet subscribed to my channel, kindly subscribe, like, and share. This is the channel where we should talk about issues concerning combating HIV and sexually transmitted infection stigma in our society. And we usually say that being positive about HIV is not necessarily being HIV positive. Thank you. Today, we are going to discuss yet another opportunistic infection associated with HIV infection. And in our discussion today, we will be talking about oral candidiasis. Thank you. Basically, this is a fungal infection that is usually caused by a fungus that we do call Candida albicans. Usually, this fungus is a pneumoflora of the mouth and the throat. This means that it can flourish without causing harm to you in the mouth and the throat in controlled numbers. Are we together? Thank you. However, in circumstances like suppressed immunity secondary to maybe cancer infection or untreated or uncontrolled HIV infection, prolonged use of antibiotics, use of oral inhaled corticosteroids, these numbers can increase uncontrollably and lead to the fungus becoming pathogenic. Are we together? Let's learn. Now, what are the presentation of someone who is suffering from oral candidiasis? There are several presentations, which includes someone will develop oral patches or patches in the mouth that are usually white in color. They may appear on the roof of the mouth, on the tongue, and inside the walls of the cheeks. They may also appear along the throat. The person may also complain of soreness or redness of the mouth. They may experience pain while swallowing. Other presentations, they may experience crackings on the angles of the mouth. Are we together? Thank you. Now, these are just but some of the presentation of someone who is suffering from oral candidiasis. Now, how do we come up with a diagnosis of someone who is suffering from oral candidiasis? One, a healthcare worker can be able to do a clinical diagnosis by just looking inside your mouth. They can be able to see the white patches. They can also be able to get the history that you are presenting with, and they can be able to make a clinical diagnosis of oral candidiasis. Other mode of diagnosis is a swab can be done inside your mouth and be subjected to a microscope, whereby Candida albicans can be isolated. Are we together? Thank you. Now, how do we come up with a treatment plan of someone who is suffering from oral candidiasis? It's very simple. For the uncomplicated oral candidiasis, we usually use nystatin oral drops. We can also use miconazole mouthwash. We also have a clotrimazole mouthwash, and they can also be used. For the complicated oral candidiasis, we usually use systemic antifungal agents, the likes of fluconazole. Are we together up to that point? Thank you. Now, let's discuss about prevention. Remember, prevention is better than cure. Now, to prevent a reoccurrence of oral candidiasis, or to prevent just a new occurrence of oral candidiasis, let's start with first things first. Let's talk about HIV. If you have not yet been tested HIV and you consider yourself at a risk of acquiring HIV, these are people who have multiple sexual partners, of whom you don't know their HIV status, people who have their who have a sexual partners with multiple sexual partners, or if you just you just had unprotected sex with someone, you don't know their HIV status. It's very important for you to get tested because you are at a greater risk of acquiring HIV. Second one, if you have been tested and you have been confirmed HIV positive and you have not been consistent or adhering to your medication, you are at a greater risk of acquiring this fungal infection because this fungal infection takes the chances on the immunocompromised persons. Are we together? Thank you. Now, so if you get your treatment a good adherence to your medication, that is ARV, if you're HIV positive, you lower the chances of you acquiring oral candidiasis. Also, for those who are using inhaled or orally inhaled corticosteroids, that is the likes of asthmatic patients, it's always good after you have inhaled your oral corticosteroid. It's good to brush your mouth so as to reduce the chances of you acquiring the oral thrush. Also, avoid unprescribed prolonged use of antibiotics. This will lower the chances of you acquiring oral candidiasis. And this comes to the end of our discussion today. Kindly, if you have not yet subscribed to my channel, kindly subscribe, like, and share. This is Isaac, Simple and Trade. Bye bye.